Hello, my name is Deb Wilder, and I had the opportunity to present on the interlibrary loan in medical libraries, specifically the role in direct patient care and information access. First, I wanted to start with a little bit about me. I got my MLIS recently from the University of Washington, and now currently a first-year information science PhD student at the University of Illinois Urbana-Champaign. I am also the former Fred Hutchinson Cancer Research Center-Arnold Library interlibrary loan technician, and my research interests, which will be intertwined in this presentation today, surround information policy, medical misinformation, clinical trial advocacy, and community engagement strategies. So first, I want to talk about stakeholders. There are three sections where I kind of break off medical library stakeholders and how interlibrary loan will affect them. We'll talk about later. First group, primary library researchers. That includes clinical trial specialists and any staff within laboratories. The second group are doctors and patient care professionals. This also segues into the next and kind of the main point of the presentation about patients, but anyone who works in a hospital, clinic, consortium, or any partnering university with your institution is a part of a stakeholder group of doctors and patient care professionals. Lastly, other medical libraries, usually on the receiving side of things, so outside libraries, researchers who are outside, and general patrons. So what is it like working with patients? Well, working with /for, and we'll make sure we cover the distinction between the two in later slides. But the first thing you want to do is remember you are always working with people. Also, these are people in very vulnerable situations, so that emphasis and that remembrance really needs to be upped. The second thing is having clear policies in place, and we'll talk about what those policies are going forward so that the patient is informed about how to engage with the library and interlibrary loan services. 3, providing material for their information need. 4, want to encourage patients to keep doctors in the loop, and we'll talk about that importance as well. And lastly, continuing that front-facing service element that the library generally has. Let's talk about why this is important. From the patient's perspective, information accessibility and literacy are two important things from both the patient and the library. As a patient, you may want to read about what you're going through, the processes, what's happening to your body, your diagnosis, your analysis, anything. So having access to this information is a great help in the process. And also with literacy, how to find this information. The second thing, more awareness about the critical roles of the library. Patients may not even be aware that the library is a resource for them and that they can always ask them a question, but also to get information that they need with relation to whatever they want to research. That factors into the comfortability of their experience, and anyone who works in a medical library knows that the overall objective is to service the work that's being done, and the work that's being done is for patients. And that factors into direct engagement in their health process. That comes with the agency that patients will then have in accessing that information. This is important for the library because patient advocacy is definitely number one. Any way that any person from the institution can factor into that is a big plus. Second thing is front-facing engagement. Who doesn't want to interact with people in addition to heavily justifying library services and budgeting priorities? The budget is a big thing to advocate for, so anytime justification can be made for contributing to the patient experience, there is more justification for more funds. Also, expanding and creating more roles ties in hand with the budgeting. Next, connecting with all stakeholders. Especially ones who may be indirectly related or overlooked. Also, being a community resource, just serving in the form of the library, and that establishes through trust. Let's address some privacy concerns. Let's talk about what ILL does and does not do. First thing ILL does is has information about requested material and general contact info from a patient. That's how we send information to people. General contact information such as email, phone number, however they want to get in contact with us to ask a question. So generally how information gets sent to people. Also, ILL does keep a record of papers and materials requested from patron. Usually may not fall under the patient's name explicitly, but there will be notation notifying that this was requested by this person, whether that be a part of a staff's member's profile or an account, but there will always be a tie to a patient's name, but not indication that it is a patient. Lastly, ILL does communicate with patients about their information needs explicitly. I need this article, or can I have something related to XYZ? And again, sometimes don't even know it's a patient. ILL does not have medical information about records or records about patients. That is a violation. ILL does not keep notes about patients, their treatment area, or trends of needs. Again, information usually about patrons does not go beyond the note that is made in a request, usually coming from a staff member. Lastly, ILO does not engage in dialogue about personal medical issues because that infringes on HIPAA, and we'll talk about that later. A few things about copyright compliance and ILL policy. Generally, copyright compliance, just to make sure that you're following the guidelines of what your library classifies under so that you understand that you're following the rules and who is able to access information, what is allowed, what is not allowed. The first thing, clear communication with patients about expectations. The policies that exist, it's the same information that's provided to researchers. This is only used for private study, scholarship, or research, and usually that comes in various forms such as a disclaimer or copyright policy notification. So what are some benefits and challenges of this? The first, I will kind of jumbled up together, so I'll talk about what's explicitly a benefit and a challenge. First benefit, emphasis on healthcare providers to notify patients of available resources, making sure that the library is encapsulated within the experience and doctors let patients know that they can always reach out to us for resources explicitly. Another benefit, patients are patrons. They engage within the library. Our library engagement increases. Next, patients should not be registered. Maybe why? That's a great question to think about. Why should they not be officially registered? Or they should not be officially registered as a patient, because that provides identifying information about personal health identification peripherally. A challenge. Direct patient outreach is either prohibited or not advised. There's vulnerability there and there's potential violation of policy. So while we cannot directly engage with patients, there are some indirect ways in which we can contribute, and we'll talk about those later and some suggested strategies. Also, we talked about HIPAA, violating on those policies around personal health information, or PHI, and then also general concerns with copyright, which we have to consider with every patron, so patients are no different. So let's talk about best practices. First thing, service disclaimer for patients. Always evaluate your organization's policies and protocol in addition to other policies and protocols you could step on the toes of, such as copyright and HIPAA. Make sure you just include information about these things to patients so that they're aware. In addition to that, let them know about personal health information so that they can protect themselves. Also, maybe this might be good, this might not be good, but let them know that there is a budget available for these things. Second thing, encourage trust building between doctor and patients. This also helps with making visits more interactive, especially with incidents of treatments between patients, and that factors into the direct experience that a patient has during treatment. Lastly, creating patient resource guides. So remember before when I was saying we cannot talk to patients and we should not reach out to patients, and also we don't really have that information. But what about when they contact us? Well, we can kind of indirectly, engage with them by just letting them know that we're there. That's not a problem. Promote agency and knowledge. There's inclusion in library promotional materials, and then also developing marketing in medical libraries so that people know that there is a resource available for them. And that comes through ILL as well. Here's a service disclaimer example from the Leon S. McGugin Health Sciences Library. First thing I wanted to notice was the first part. That is probably the most important part because what it does is it lets patrons and patients know that only a health professional, doctor or nurse, can interpret the information that's provided in medical literature. In addition to that, it lets them know that the library is served as a resource capacity only, and that if they have any questions, to follow up in contact with their doctor. This entire thing is very important to read, and I think it's a great model for a service disclaimer, but those two are very specific towards ILL and also information access. So what about beyond interlibrary loan? What can patients go for? So here are some supplemental methods. Share information about different accessibility projects specifically geared towards patients, such as Patient Empowerment Network, the Elsevier Program for Accessibility, and public library collaboration. Some public libraries may have access and through their interlibrary loan system to get medical information or to get medical articles and literature, for patients. And they don't even have to disclose that they're a patient. They don't have to disclose it with us, but that's just another resource they can use in addition or in lieu of the library. So here's some potential projects and investigations specifically around ILL and document delivery and document loaning and document sharing around patients, right? Conducting library staff interviews, conducting research staff interviews, having library assessments about engagement between patients and the library, and creating a resource guide for medical libraries and highlighting their role in patient care and training. This all came from inspiration from Joanne Gard Marshall, an article back in 2013 talking about the value of library and information services in patient care as a result of a multi-site study. I think that can be applied, especially in the interlibrary loan sense, and how patients can engage with interlibrary loan. Lastly, I just want to address some of the conclusions and takeaways from this presentation. The first is to consider all possible stakeholders in your institution and conduct an impact analysis. While patients don't seem like they are a direct stakeholder, and they're not, they're an indirect stakeholder, there could be passive ways to make them direct, but also the point blank simple is that they are important. Also, while patients are patrons, always consider the greater form of vulnerability they have, and that factors into the engagement that you have with them. Next, amidst being of service and information needs, always consider the policies around ILL, copyright, HIPAA. Make patients aware of these things too. It is a two-way street, the commitment to make someone aware and then the awareness that someone has towards their commitment of participation and interaction. Lastly, indirect methods can still make a direct impact. Here are the resources and links to everything that was talked about today, some universities that were highlighted, some copyright policies that I used and kind of did some analysis with. And also, if there are any questions, feel free to email me at my email. My contact information is here. Again, my name is Dev Wilder. I'm an MLIS, and my LinkedIn information in case you want to connect. Thank you so much.